here. Now we are starting our class, and so so there are how many? 9 students. So it will be, well, Akram, are you here?
I'm here, Professor.
Okay, Yahya. Yahya, hello.
Yes, Doctor, I'm here.
Then Mustafa Sabir.
Yes, Doctor.
Mustafa Ahmed.
Yes, Dr. Amir.
I see. Okay. Hashim Hassan.
I'm here, Doctor.
Yasmin.
Here.
Muhammad Hassan.
Yes, Doctor.
Shema.
Yes, Doctor.
Nisanur.
Yeah.
Yunus. Çelik Yunus Emre. No, I see. Well, let us start with this, sharing this screen. And so today we continue speaking about medical jobs, working in general practice. And we start the class with the following, with the comments on the previous homework. You remember that the task was to complete the sentences with the verbs in present perfect or past simple tense. So we spoke about this at our previous class, about the difference in the meaning of these verbs. And so here are some screenshots of, from the students' papers with typical mistakes. For example, sentence 3, the student means to use the present perfect tense. I studied German at school, but I forgot most of it now. And present perfect is correct here in this sentence because the person speaks about the current situation. I mean that he says that the result is, I don't remember anything from German now. Yes, this is the result. So that is why we need to use the present perfect. But the form of the present perfect, so the student does remember, it should be have or has plus the third form of a verb. Here, forget, forgot, forgotten. The third form should be, but I have forgotten most of it now. In the next screenshot, we can see sentence number 6. You are ready to go. Did you finish your coffee? Well, so the student just wants to use the past simple tense here. But you remember that the past simple is used when the time is defined, when you know when the action happened. If, for example, the sentence was, did you finish your coffee 5 minutes ago, half an hour ago? It's all right. But the time is not mentioned here. That is why the focus is not on the time, but the focus is on the result. So is your coffee cup empty? You are finished. So it should be present perfect, like, have you finished your coffee? So the next sentence, number 9, it says, quick, we need to call an ambulance. And the student writes, there was an accident. The same, the focus is not on the time of the accident. So the emphasis on the fact that there have been an accident. So that is why we also need to use the present perfect tense. There have been an accident. Okay, or has been. Well, and in sentence number 4, so the student writes, the police have arrested 3 people. And but later they let them go. So here there are 2 actions. There are 2 verbs in the sentence: arrest and let. And so they follow one another. First arrested and then let go. In a narration, when we describe something and one action follows the other, so we normally use the past simple. For example, if you describe what you did yesterday to your friend, you use the past simple. That is why instead of have arrested, it's better to use the police arrested 3 people. And so anyway, arrested is not connected with the present. So they arrested in the past, and only after this they let them go. So present perfect is used when it's connected, the action is connected to the present. Well, then sentence number 7, I have applied for a job as a tour guide, but I wasn't successful. If, for example, we didn't have this sentence, but I was not successful, it's possible to use the present perfect. I have applied for a tour guide. So this is like the result. So I have done my application, but I was not successful. It means that it belongs to the past. So there's a verb was, so 2 verbs in one sentence, like following the action following first applied, and then the next action is wasn't successful. So it should be in the past simple. And the sentence number 11, the student was right to use the past simple tense, but the student forgets about the how to make up a question if the verb is used in the past simple form. So to make up a question, we need auxiliary verb did. How did that happen? It should be like this. So do you have any questions about the home task? Is everything clear? Hello?
Yes, everything's clear.
Okay, good. And well, yes. So as for the presentations that you presented last class, so I've I put all the grades to Moodle site on Monday. So this is the grade that you can see on Monday. This is for presentations. Okay. And I still didn't get any tasks from Shema. Do you plan to continue studying? Because out of 50 points, which is maximum score for the previous classes, so you've got only 9. It's very low score. So,
Doctor, what task?
can you see? Can you log into Moodle site?
Yes, sure.
Yes. So you should find foreign language, and so each there are just assignments for each week, and Of course, you missed the deadline, but you can still do the tasks and upload them to the site and get some score, but zero. Mhm. Well, and yes, today we're going to continue speaking about working in general practice, and the first task here is the listening task. I would like you to, we're going to listen to the conversation between two people. Mr. Bloomfield, he's 28 years old and he works as a civil servant, and he is meeting locum GP, Dr. Dixon. And Dr. Dixon is taking a case history. And so let us focus on the meaning of the words which are given on this slide. So Mr. Bloomfield is a civil servant. Civil servant is an employee, a person who works for the government, like a teacher or a doctor, or works in, for example, city administration, works for government. And the locum GP. You remember that GP stands for general practitioner. But what does it mean, locum? This is a general practitioner who stands in for another doctor who is temporarily away on a holiday or off sick. It means that this is the doctor who has just come to this surgery and to this office, and he doesn't know much about the patients who normally go to this general practitioner, and so he needs to ask a lot of questions anyway. And well,
So like a substitute.
Yes, you are right. Yes, locum, a substitute, you're
Okay.
right. And so here we can see the form that the doctor needs to complete. And so before we just start listening, I would like you to remember the abbreviations. So you can see that the form consists of several parts. The first part is titled like PC, then HPC, then the next is PMH, and family history. So who remembers the meaning of PC? What does it stand for? What do these letters stand for?
Is the computer desktop, isn't it?
Personal computer. Yes, in just in computer study, this is personal computer. If you speak about medical practice, so do you remember the title of Unit 1? So in the book, so this is the PC. If a patient comes to a hospital, and why does he come to a hospital? So Americans call it chief complaint, and in the United Kingdom, it's called.
I thought it was patient complaint.
Presenting complaint. Yes, presenting complaint. And so in this part, in presenting complaint, so it means what the patient says about his condition. So there is a CO. What is CO? So
why he complained?
Yes, complaints of something. Yeah. Then HPC.
Hematopoietic.
Yes.
Hematopoietic.
Will you speak louder, please? I can't hear you.
Hematopoietic Burjini Tursel.
So here HPC is also presenting complaint, but history H stands for history of presenting complaint. And PMH is so also history H, yes, past medical history. Write it down, please, because so there'll be the task, some questions in the test which we're going to take next week. So connected with the
I'm
meaning
sorry,
of
what was HPC again?
HPC, history of presenting complaint.
Okay, thank you.
And here this is EMH, past medical history. And so there are some words, just we need to clear out the meaning of these words. Contributory mean helping to cause, like here in line number 9, contributory causes. And precipitants are factors which cause something, that go before something. This is the same line. Well, if we have a look at the form, I think the other words are clear, easy to understand. Now we are going to listen to the conversation, and you'll tell me if you can hear.
Listening to.
Do you hear?
Yes, doctor.
Yes.
Okay, now.
Listening to.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. when I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses?
Um,
High blood pressure, diabetes, or heart problems?
no, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Okay, and you see that the patient gives some more information which is not presented here on this slide. So it's
Listening to.
we can see this on the next slide, on the following slide. So we should also we are going to listen for the second time just to understand better, and we please also pay attention to these things like what triggers the attacks, any infections, medications, physical activity, pets, problems at work, and mortgage. So now we'll listen for the second time, and then we will discuss.
Listening to.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses?
Um,
High blood pressure, diabetes, or heart problems?
no, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Okay, let us discuss what we've written here in the first part of the form about presenting complaint. So Akram, so what did you write? Number 1, 2, 3, 4.
Okay. So is the first one is breathlessness.
Mhm.
Second is wheezing. Third is cough.
Productive cough. Mhm. With white
With white phlegm. I think.
phlegm. You are right. Mhm. Good. So now let us focus on history of presenting complaint and listen to Yahya.
A task force
When? So who can help us? Attacks are worse when?
in the
Doctor.
chest.
When? Sorry.
In the chest.
I mean the time, not the location. Yes, Husan?
Hassan, Doctor. At night.
Hassan, yes, sorry. Mhm. At night and
In the morning.
in the morning, yeah. Okay, so
3 times a week.
yes, number 7, what should we write here?
3 times a week.
Yes, wakes the patient about 3 times a week. Are the symptoms chest?
Chest.
Tightness, yes.
Sentences.
Chest
Chest
tightness. And well, then contributory causes. What should we write? What did we write in number 9?
No allergies.
Okay, so
Known.
no known precipitants, yeah. And history
Oh.
suggests what? So the diagnosis, what is it? So hasn't anyone understood the this word in number 10? Okay, let's leave it.
Don't sure, but maybe pneumonia.
Exactly, this is asthma. Yes, history suggests asthma. I don't remember. The doctor doesn't say about this, but we can just predict that this is asthma. And then post medical history, no history of what attacks. Mustafa Sabir. Number 11. What did you write, Mustafa?
No history of attack.
So this is history about the past events, yes? Past medical history. And he says that this is the first time I've been ill, he says, right?
No history of infection.
So actually we should write no history of previous attacks. And the family history, so mother and his sister, so there's a disease. What kind of disease does Mr.
Eczema?
Eczema, yes. So they have eczema. Well, and so this is about the doctor's notes. And if we look at these questions, so what does Mr. Bloomfield say about things that trigger the attacks? So Mustafa Ahmed, things that trigger the attacks.
He don't have any problem about figure.
Yes, he says the doctor asks about dust or new carpets, and so Mr. Bloomfield says that's no connection. Okay, then if he's had any infections recently, Hassan? I mean, Hashim Hassan. Hashim Hassan, hello, are you here? No, minus.
Yes, doctor, I'm here.
You are here. So, and
Yes.
so can you answer the question, Hassan?
Taking any medication?
Any infection,
Uh,
infections?
Number 2,
Yes, the second line.
if he has an infection. No, he has no problem, but neighbor have a cat and doesn't see her much.
Yes, about infections, he hasn't had any infections. And about medications, Yasmin? What does he say about medications? Is he taking any? Is Yasmin here? Not here,
Not
I
here.
see. Mohammad Hassan,
Yes, doctor.
about medications. Is he taking any medications? As far as he says that this is the
I see.
first time he's been ill in his life. So, yes.
I think no.
No.
Yes, Mustafa, no, he isn't taking. About physical activity, Shima,
He's not active, no.
he's not doing anything. And about pets, Nisanur,
He doesn't have any pets, but his neighbor has a cat.
but he doesn't contact with his cat, yeah? Well, and problems at work, Akram. So does he have any problems?
So, Professor, any problems? I think he had.
Yes, he has some problems. A lot of things are changing, he says, and he's stressed about this, right?
Had asthma, pulmonary edema, I think.
Okay. And the last line here is, what does he say about mortgage? Yahya. Yahya, hello?
Yes.
Do we
About
understand
mortgage-
what mortgage is? Do we know this word mortgage?
Actually, no, but I will suggest what is the meaning of mortgage.
Mortgage, what is it?
So,
This is connected with accommodation. For example, if a person wants to buy a house but doesn't have enough money, so he goes to the bank and signs the agreement that the bank provides some, some loan to this person, and this kind of loan is called mortgage. And then, so the person buys a house and pays the money back plus the bank interest. So, and is he worried about his mortgage? Mr. Bloomfield, is he worried about this? Yes, because he's not sure about his future because of his work, and he's stressed about mortgage. Okay, so this is the way the doctor should ask the patient to understand his condition, and when the doctor analyzes everything, all the factors, he could think of the right diagnosis, like here, this is asthma. Well, yes. Now, the question, why are the past medical history, family history, social history, and drugs and allergy history important? Well, Mustafa Sabir, can you answer this question, Mustafa?
Yes, doctor.
Are these facts important? Actually, yes, they are important because the more the doctor knows, so the better it is for the correct diagnosis. Okay, so let us just stop and pause